Hi guys, Dr. Shruti here. I'm back with yet another small topic which is pretty important for you guys for UG first year exam perspective, clinical perspective, and also NEET PG exam perspective. So, what is dangerous area of face? So, if I'm going to mark a nice triangle on this beautiful face, right, covering the nose region and the upper lip, all right. This triangle is known as the dangerous area of face. Why we need to know the dangerous area of face? Well, for that we should understand how the venous drainage of face works. We're going to talk about two love stories here, okay? First is a wedding between this one vein here. This vein is called as the supratrochlear vein. And the supratrochlear vein falls in love with another vein which is called as the supraorbital vein. So the supratrochlear vein falls in love with the supraorbital vein, and where is this proposal happening is in the medial angle of the eye. After they propose, they get married and they have a child, and the child name is the facial vein. Okay, the child born to these two are called as the facial vein. Now facial vein is waiting, has reached his mature life. Now the next another parallel of story is happening here. Okay, that is the superficial temporal vein. Now the superficial temporal vein is also coming down, and on the way it meets its companion, that is the maxillary vein. So the superficial temporal vein falls in love with the maxillary vein, and their product is the retromandibular vein. Okay, and now the retromandibular vein does not have one kid. I mean, the superficial temporal and the maxillary vein don't have one kid, they have twins. So they have an anterior division of the retromandibular vein and a posterior division of the retromandibular vein. Now the anterior division of retromandibular vein happen to go meet the facial vein, and both of them together unite to form the common facial vein, and this common facial vein will drain into the internal jugular vein. Okay, now the twin retromandibular, that is a posterior division, can't be alone. It also meets its love companion, that is the posterior auricular vein. It meets the posterior auricular vein, and both of them together forms the external jugular vein. Alright, so this is a casual story how the veins are formed in the face. So the main person in relation to the dangerous area of face is only the facial vein. So once again, the supraorbital vein and the supratrochlear vein together, they give rise to the facial vein. Okay, this is the facial vein. Now the facial vein won't be alone during his days, no, it will have its own friends. So they are the tributaries. So you have one tributary here, that is the superior labial, the inferior labial, and some tributaries are really deep, very close, thick friends. Okay, so let's just identify the thick friends. So let's just remove these people off the screen. So now there are some deeper friends. Okay, the deeper friends is one of the friend is called as the deep facial vein. Deeper friends are called deep facial vein, and another one is a superior ophthalmic vein that passes through the orbit. Okay, this is a superior ophthalmic vein. Now these two people are connecting this facial vein to another very important person, and that person is sitting in the middle cranial fossa, and this venous pooling of blood is called as the cavernous sinus. Okay, the superior ophthalmic vein is directly connecting it to the cavernous sinus, whereas the deep facial vein gets connected to a plexus of vein, and this plexus of vein is known as the pterygoid venous plexus because it is literally sleeping on the lateral pterygoid muscle, and from this plexus arises a vein that is the emissary vein, and this emissary vein will go and open into the cavernous sinus. So now, do you identify why this area could become dangerous? Yes, this area, why it becomes dangerous all of a sudden? Yes, because there is a deep facial vein which is getting connected to the cavernous sinus, which is inside the cranial cavity through a pterygoid venous plexus. Okay, so if any infection, any pimple that appears here get infected, the infectious material enters through the facial vein and can go all the way into your cavernous sinus, which could give or result in very dangerous complications, right? So this is just to show you where exactly the cavernous sinus is. Okay, if I draw a small box, this is exactly where it sits. On either side of the body of the sphenoid you have the cavernous sinus, and here you will find the supraorbital fissure, and if I want to connect the cavernous sinus, it will pass through this to the superior ophthalmic vein. This is another first connection. Another way to draw, once again, to elicit how it works. Yes, you have the first vein, that is a supratrochlear vein, and the supraorbital vein. In the medial angle of the eye, it's become the facial vein. It will go like this. The vein goes like this. So in between there is this superior orbital fissure. Through the superior orbital fissure comes one connection. This is the superior ophthalmic vein, and the second connection goes this way here to form the pterygoid venous plexus underneath, okay, inside or behind the maxilla, and through that the emissary vein, again it gets connected to the cavernous sinus. Yes, so this is a very good picture showing you the facial vein. Of course, here this is the facial vein that you're looking at. Through the facial vein you have the deep facial vein that is going and getting connected to this plexus of veins known as the pterygoid venous plexus. From the pterygoid venous plexus there is an emissary vein that goes and connects it to the cavernous sinus. Yes, so if I want to say once again, make the flow chart for the dangerous area of face. The supraorbital vein plus the supratrochlear vein will give rise to the facial vein, which is having a tributary called as the deep facial vein, which in turn is connected to the pterygoid venous plexus, and through the pterygoid venous plexus, it is, I mean, from the pterygoid venous plexus comes an emissary vein, and from the emissary vein it goes into the cavernous sinus. Okay, so this is what you should know for dangerous area of face. So the MCQ I'm putting for, so there are two MCQs for you guys to solve, very easy MCQs, that is was asked previous NEET questions. Infection in dangerous area of face leads to a superior sagittal sinus thrombosis, a transverse sinus thrombosis, cavernous sinus thrombosis, and D, brain abscess. I think it's really easy to answer this. The second MCQ is dangerous area of face is named because of its connection of cavernous sinus with facial vein through maxillary vein, anterior ethmoidal vein, posterior ethmoidal vein, and deep facial vein. So kindly give in your answers, drop in your answers in the chat box. Hope to see you soon with another video. Thank you.